Hi team, we are going to demonstrate donning and doffing for an airborne isolation patient using our Maxair PAPRs today. We're going to include the role of the observer to better demonstrate the importance of that role. We do also want to highlight that the shrouds and the sweatbands for these Maxair PAPRs are single staff member use per patient. So it's important that if you do have a patient that you're intubating, that you make sure you're using the same PAPR for yourself throughout that patient's stay, and then once that patient leaves, that you are getting rid of that shroud and sweatband and replacing it with a new one. We do the donning here in the hallway for room 15, and we're gonna demonstrate that here in a moment. So these are the PAPRs, the bowler PAPRs that are kept on the hospital side. These ones are entirely wipeable. So you do want to wipe these down after you use them before you return them into the case. In addition, with these, they do have an exhaust sort of device on them, so these ones do have to be worn over your isolation gown versus our Maxair PAPRs that have to be worn under the isolation gown. So Sarah, I'm going to have you perform hand hygiene.
All right, number 404.
And then you're going to apply the belt for the PAPRs that we have in the ED. Next, I'm going to have you grab your isolation gown. Slip that over your head. Place your arms into the sleeves and your thumbs through the thumb holes. And then you're going to put on the shroud for your N95, or your PAPR, excuse me, and plug that into your belt. Before you apply it, you're going to check for the lights on the front of the PAPR to make sure that they're lit up appropriately. Checking our lights. There are ventilation adjustments in here as well as size adjustments for the PAPR. And Sarah's tying her gown.
Amber's going to make sure that I'm fully covered with my gown, that nothing's hanging out.
Sarah has confirmed that the shroud and sweatband are new, as this is a new patient for her and the first time she's wearing this PAPR today. And then you're going to apply gloves next. You're going to make sure that the gloves are covering the wrists of your gown. Do we want to double glove? Sure. You can double glove so that if you have soil gloves in the room, you're not exposing your hands when you need to change those gloves inside of the room. And again, at this point, I would also be wearing full PPE. But for the purposes of being able to hear me as the observer for the video, I'm not going to, but we would enter the room. You are correct, fully covered. So here in the room, Sarah is going to doff her equipment after caring for the patient. As the observer, I have stayed in my clean zone over here, but I'm still wearing my full PPE and observing Sarah as she doffs, as well as providing her instructions throughout the process. Sarah, the first thing you're going to do is disinfect your outer gloves. Once that's done, you're going to remove just your outer gloves. You're going to disinfect your inner gloves. And then you're going to remove your gown. You're going to disinfect the gloves again. You're going to remove your papper and place it on the dirty table.
Is this the dirty table?
You're going to disinfect your gloves again. And then using the purple sandy cloths, you're going to disinfect your papper. Now that this is clean, you can hand it to the observer. Again, I would be wearing full PPE. You're going to disinfect your gloves. And you're going to disinfect your shoes using the purple sandy cloths. Sarah, I believe at this point you can also remove your belt and wipe it with the sandy cloth too. And now you want to remove your gloves and immediately go to the station and wash your hands. And by station, I mean sink. And you will exit this way and out the door. So here in room 15, we have specially arranged the room for the need to intubate a patient and still have an antechamber prepared for our staff to don and doff appropriately. So you'll notice that on the floor there is tape placed. The bed should not be moved any further to the right past this tape. Otherwise, your ability to don and doff in the room or to doff in the room is compromised, and you can't safely do that. So you would have to, the provider would have to intubate here at the top of the bed. All of the equipment should be able to reach. You do have a monitor here with end tidal capabilities that is on wheels. We do have the option to get 20-foot suction tubing so that you can still use this suction and reach the bed. We also have all of the blood pressure extra equipment and things like that moved further over so it's closer to the bed. Here is the observer chair. This is where the observer should be stationed, providing feedback to the staff members that are in the hot zone or in the zone where they need to doff, that dirty zone. The dirty table here should not have any clean supplies on it, like gloves. It should be regulated to just having the sandy wipes and hand sanitizer on it. If you leave boxes of gloves on that table, when you set your dirty papper on there, those gloves are now contaminated. This is your clean table here to pass supplies to your observer once they are cleaned, if needed.